Well, good afternoon, everyone. This is Grace Parker, Chief Nursing Officer, welcoming you to our first ever NED Talks, Nursing Education Talks, to kick off Nurses Week. Really glad you could be here to celebrate with us. First off, we're going to have Rekha Matken join to talk about REI Nursing Now and Then. Rekha has been in the field of women's health for over 25 years. She joined UW as nurse manager in August of 2015. Prior to that, she had her own private practice in Scottsdale, Arizona for 7 years. Her prior experience has been at Genetics and IVF Institute in Fairfax, Virginia. She headed the MicroSort Gender Selection Program and also pioneered the PGD program, which helped patients with genetic disorders. She has also taught in nursing school to BSN students and precepted nurse practitioner students. She is very excited to be here to take the URC, University Reproductive Care, to the next level. Rekha, please come up. Thank you so much.
I want to thank you, Grace and Carol, for asking me to do this, and thank you for all of you for being here. Since this is the start of Nurses Week, I wanted to start off with a quote. My friend, who's been a nurse for over 40 years, sent this to me. She wrote, "You don't build a house without its foundation. You don't build a hospital without its nurses." And I think that was so appropriate to start this off. So I started here back in end of August, September, to be a nurse manager at University Reproductive Care. So I'm going to tell you a little bit about who we are and what we do. This way. So our healthcare team, these are our providers. First, let me tell you where we're located in case people don't know. We're at Roosevelt 2 on the 4th floor, right next to, we share the space right next to women's. Our providers, we have 3 providers on staff. Emily Danforth, who's a midwife, ARNP. Dr. Neil Perry, she's the division chief, as well as Dr. Woodford. We have a team of our embryologist, as well as a lab director. Our nurses, Naomi's one of them. I brought her with me today to be here. We've got a couple of medical assistants, Andrea and Andrina, myself, and then Hannah, who's now going to the Department of OBGYN, and then our financial counselor. The services that we provide at URC, we're a comprehensive clinic. So we do a full realm from starting with ovarian testing, which is testing for the female as well as for the male. We do intrauterine insemination. We also perform in vitro fertilization versus in vivo. And I put that up here because I don't know if everybody knows what in vitro means. In vitro means outside the body. So our embryologists put the eggs and the sperm together to become an embryo outside of the body, whereas in vivo is inside. So when we perform procedures like intrauterine inseminations, those are inside. We do donor egg, fresh and frozen, and we also offer fertility preservation for elective reason as well as for cancer patients. Today I thought we would do a little compare and contrast between Naomi and I, I've been here 8 months at University of Washington, but I have over 23 years of experience in REI, which stands for Reproductive Endocrinology and Infertility. So when we get certified as nurse practitioners in that specialty, it's actually reproductive endocrinology and infertility. Just some background, the physicians, the providers also do a 4-year, their OBGYN residency, and then they do another 4 years of fellowship. So it's a long training for our providers. I had my own private practice prior to this in Scottsdale, Arizona, which when Carol called me, I thought about selling my practice. With all the tribulations with having your own, the financial aspects, I thought it was a better part of my life to do something like this, and I am so very happy to be here. I have fathered over 1,000 babies in my career of doing this career. The best part is I don't have any child support to pay. It's great. It's awesome. Part of when I was at Genetics and IVF, we had the Saturday before Mother's Day, we would invite all of our babies to come back, and we called it a baby party. So all of our babies came back, and we had face painting, and so I envisioned this for our clinic here. as we go on and make more babies. So my journey, I started doing infertility in the early 1990s, worked with when we were teaching patients glass ampules to break off the top, draw the medications. All the medications were IM injections. We are now using pens, easy like insulin pens, sub-Q injections, so much nicer. So the technology has really come far ways. Worked with the whole realm from when I first started. We were able to freeze sperm, then we were able to freeze embryos, and now actually we're able to freeze eggs, which is, this technology has come a long way. Not only are we able to freeze eggs, we're actually able to thaw them and then make embryos. So it's just, for me, it's amazing. We freeze for elective preservation as well as patients from SCCA. So some of our older patients who haven't found Mr. Right want to freeze eggs so that they can use them later when they find Mr. Right. And then we also have it for our cancer patients. I keep trying to tell them there is no Mr. Right. Let me tell you Simi's story, which is my niece. I get a call from my sister at 10 o'clock at night one night, and I'm actually at the hospital. My friend just had a baby, so my phone rings and I answer it, and it's my sister, and she says, we're at Sibley. I don't know if anybody knows Sibley Hospital in DC, with my niece, Simi. And she said she's been having pain for the last couple hours, so we brought her into Sibley Hospital. I said, well, what else is going on? And the only other symptom was that she's not had a period in 6 months. So they get to the hospital, they do the testing, they do the ultrasound, and come to find out that she's got ovarian torsion, which means that one of her ovaries is twisted and has become necrotic. So it has to be taken out. So she calls me freaking out. She's not going to be able to have a baby. What's going to happen? What's going to happen to her? She's 14 years old. So knowing that I was in the field, that's what she did. She called me. I got a team together. I knew the lab director over at Genetics and IVF. I'd worked there for 11 years. Called him up now it's probably like 10:30 at night. Within an hour, we got a whole team together at Sibley Hospital to get this ovarian tissue and save it. So save a slither of it. So we were able to freeze a little part of her ovary, which she now has frozen in case she needs to use it later. So it'll stay frozen until she's ready, and then you can implant it. So they've done 10 of these cases where they've actually taken a slice of the ovarian tissue and then later implanted it into an arm, to a leg, where eggs will grow. So, and out of the 10, there are 2 that I know of success stories that have gotten pregnant. So that's where this technology has gone. So as you can see, the whole realm, it's really come. We've been able to do a lot. And each day there are advances as we move further and further. So is Simi going to use this ovarian tissue? I don't know. Will she ever meet Mr. Right and want to have a baby? I don't know. But you know what the best part is? That she has the option. And that's what we're doing here at URC, we're giving women the options to be able to make those kind of decisions. And our goal is to help people have healthy outcomes each and every day. My friends that I know always call and try to recruit me. Rekha, don't you want to do something different with your life? You've done infertility for so long. Don't you think it's time to leave the field? And my answer is, why? I still get goosebumps when I give positive pregnancy results to a patient. My journey has been full of rewards, very fulfilling. I never once wanted to do anything else but this. So very happy to be here. I want to introduce, since this is Nurses Week, I want to introduce one of my nurses. One of my jobs in the last 8 months as nurse manager was to hire a nurse. Thanks, Carol. And in my mind, I wanted to get someone experienced, because you know how it is with nurses. You don't want to put in, it's a lot of training, especially with infertility. You can't find an infertility trained nurse. There's a lot of training that's involved. So we hired Naomi. She's been here 5 months, and I want her to give her viewpoint of what it's like to work at URC. So, thank you.
Thank you. And I guess we could say that you didn't find an experienced nurse, because I am totally new to this area, and I think, like most nurses, changing specialties felt like, probably, should I do it? Will I lose those skills? Will I like the new job? Will I fit in? Will I be happy there? And ultimately, the clinic hours enticed me so much that I decided to give it a shot, and I'm really glad that I did. I've been there since December, and I've learned a lot, and I still, I think, have quite a bit to learn. But you know, I think that from like week one, I started feeling like a member of the team and a member of the family. I don't think I've ever gotten so much encouragement in my whole career as I have from Rekha and from the other staff, who've just really welcomed me. And the nurses who taught me were amazing and made me feel like I can do this job and I can be good at it, so I'm really thankful that I took the leap. I am coming from labor and delivery, where I worked for 11 years, which I loved. But I feel like that background has kind of helped me to know how to work with these women, even though they're kind of at the opposite end of the pregnancy spectrum. They're emotional, they're stressed out, they're hormonal, and so there's a lot of similarities, I think. And then they come to our clinic and we give them medications, and their hormones really go crazy. So it's kind of an interesting dynamic, I think. On Monday or Tuesday, there was a patient who had finished her visit and had left, and then had come back in and was crying in one of the rooms. And, you know, the MAs were like, "Can you come see what's wrong with her?" So I went in there, and she was just sobbing and, you know, so upset. And I was like, "Oh no, what's happened? You know, what can I do?" And she was really upset about a scheduling thing that to most people would have been a really minor thing. But when you're just so amped up and there's so many emotions kind of tied to this whole process, you know, she was just really hysterical, and she was like, "I'm just such a hot mess." And it's true. That's actually, I think, how a lot of people feel when they go through this process. And so anyways, we were able to calm her down, and she called later, and she was like, "Thanks so much for talking." And I was like, that's kind of like one of the best parts of my job, is I get to talk with you guys and, you know, try to like help you be like, okay, I can do this. Also, she was fasting for labs, which didn't help her at all. And when I found that out, I was like, go get something to eat, and then you'll feel better about this whole thing. Let's see. As nurses at our clinic, we sometimes get to give really great news, and we sometimes have to give really bad news. And I have been kind of in awe of particularly one of the other nurses I work with. You know, she's right next to me, so I listen to her giving some of this news over the phone. And, you know, none of us like to do it. But, you know, one time she hung up and was like, "Oh man, that was the worst. I hope I did a good job." And I was just like, "Oh, you did a good job. I would love to get bad news from you. Like, if I had to get bad news." Like, they're just so skilled at handling kind of really delicate situations. And so I think the nurses that I work with are great. The whole team really is great. We also, I got to give some good news recently, actually, to a patient who I've done several, should I go to the next one? Oh, okay. I've had the opportunity to work with one specific patient for several different procedures and visits to our clinic, and they're kind of a quirky, cute, younger couple who came to our clinic because of a male factor, is what they thought. But they actually found, in addition to that, at 30, she had lost most of her ovarian function, which was a surprise to them. And so I've been there for a few of their procedures, and got to give them some really great news recently that they were pregnant. And then we've seen them a few times for ultrasounds, and their pregnancy is going well so far. So it's kind of neat. It's, you know, there's a lot of opportunities for heartbreak, and it's great that we can be there for those things and support these patients, but also sometimes it's really fun and exciting, and we get to give really good news. Speaking of delicate situations, right after I started at the URC, we had a patient complaint to patient relations, And, you know, most often the female partner is our patient, but we also obviously interact with the partners, the male partners, specifically to kind of coach them to get into the right abstinence window for when they're going to be giving a sample to get the optimal sample. And we had a patient who actually complained that he was in so much pain because of the 3-day window, abstinence window, which I thought was hilarious. And it just confirmed to me that no matter where you go in nursing, there are interesting individuals who will say funny things. So I'm sure there will be many more stories. I hope there will be many more funny stories like that and more good news to give. And even though I'm new and I still have a lot to learn, I'm really thankful that I'm there and that I am part of a team. So thanks for having us.
Yes. And we wanted to say that we want to continue our journey here at UW.
That's right.
Together for a very long time.
Yeah.